Okay, I think we've got everything muted. I'll start over again. Welcome to the Home Healthcare Workers and Coronavirus How to Protect Yourself webinar that is put on by the University of Cincinnati Education Research Center. I will introduce our speakers in a second, Jenny Cox, Gordon Gillespie, Susan Rootman, but there were other individuals that were involved, Tina Raponen and Sergey Greenspan, and myself, Kermit Davis, putting this together. This is a continuing education program that we can offer credits, CE credits. There'll be a short survey that you'll need to click on at the end to get those.
That's what your class.
And then can you, and if at any time to ask a question, send me a chat that can go directly to me, and I'll ask it at the end. I do want to point out that our Education Research Center is here to reduce work-related injuries and illnesses by performing prevention research, as well as providing high-quality professional education in occupational safety and health. We're sponsored by the National Institute of Occupational Safety and Health. And this is sponsored by our Education Research Center. One other aspect that I would point out is we are doing quite a bit of home research in home health care, trying to identify hazards for the workers because they do encounter many of them, even above the COVID-19 hazards. We have two ongoing objectives and studies that are going on that we are identifying ergonomic and safety hazards in the homes through direct observation. And we're also applying emerging technologies and assessing aerosols and controlling home health care's exposures to aerosols. We have a couple of ways you can get further information from us by our website, our ERC blog, our Circle, or our Twitter account. Certainly, if you want to like us on Facebook, you'll be able to get a lot of different information that goes on from our ERC throughout the year. At this point in time, I would like to turn it over to Jenny Cox to share her presentation, and she'll be presenting the real background and the science behind how to protect yourself in this environment.
Great, sounds good. Thanks, Kermit. So, like you said, I'm Jenny Cox. I am a postdoc. Quickly go over what COVID-19 is and the recommendations by the CDC and NIOSH at this time. So, as we all know, COVID-19 is an infection caused by the coronavirus SARS-CoV-2. It's a respiratory illness that spreads from person to person. Symptoms include a high fever, cough, shortness of breath, red eyes, and tiredness. So the transmission routes for COVID-19 is the way the virus moves from infected to susceptible people. So you can see that in the figure, the outline person is the infected person, and then the gray individuals are the susceptible people. So when sprays or splashes occur, when an infectious person coughs or sneezes, and this creates that cloud of infectious particles, the large droplets, which can constitute the spray or splash, can occur within approximately 6 feet. They can land on the susceptible person's eyes, nose, or mouth and cause an infection. They're also susceptible to close range inhalation when those medium to small droplets of the virus are small enough to breathe in, but they really don't travel over the long distance. And then the person at the far end is for the long range inhalation when the virus is aerosolized into tiny particles. and those particles can survive on the air currents over a great distance in time, and they can reach that susceptible person. So airborne transmission can occur when an infected person talks or coughs or sneezes. It also can be created when a medical instrument aerosolizes the virus as well. So the last topic, or the last transmission route I wanted to cover, was the fomite, which is contact contamination. And that's when a person that has the virus may wipe their nose and then touch a doorknob or a sink handle. And then a susceptible person may touch that same surface. The virus can last, depending on the surface, several days on like metal, for example. So the real way to avoid this kind of transmission is, depending on the surface, is to really protect yourself by washing your hands frequently, using alcohol-based rub, or using soap and water. So when you're thinking of protecting your workers, like this diagram is from the National Institute for Occupational Safety and Health, and there are control strategies on how to protect workers. So when we think of engineering control strategies, we're thinking of ways to isolate people from the hazard. Administrative control strategies would be to change the way that people work. And last, which is the least effective control strategy, is personal protective equipment. The reason it's least effective is usually because it's a high level of worker involvement. We really are counting on the worker to wear the equipment effectively, properly, consistently. And for right now, whether or not the person has enough of the PPE in supply. The reason home healthcare workers can't really rely on engineering or administrative controls is because we don't really have control of the home. Homes typically have a lower ventilation rate than hospitals do. And so we really can't depend on our engineering and administrative controls when we're just stuck with the PPE. So NIOSH had developed a hazard review for hazards in the home healthcare setting, and specifically recommendations for workers when it came to infectious diseases. First, they recommend to follow your employer's infection control plan, to use appropriate PPE like gloves and respiratory protection when necessary. And lastly, to train patients, family members, and home visitors on the proper cough etiquette, hand hygiene, and social distancing. So I just wanted to cover a couple of the different types of respirators, just so you're familiar with what they look like and how well they can protect you. So respirators, I'm going to start with the one up in the top left corner. That's a half mask or dust mask. And each of these respirators have a assigned protection factor, and that's the level of protection a well-fitted respirator is expected to give. So for that one in the top left corner, it's typically like an N95, and it would have an assigned protection factor of 10, or would reduce the exposure 10 times. So in order to use the N95 or any of the top 3 respirators I'm about to talk about, you would need to be fit tested for these. And a fit test is when I'm getting feedback from somebody who's not muted. Thank you. So a fit test is when a professional will qualitatively or quantitatively evaluate the fit of a respirator on an individual. So someone will show you how to put it on, make sure it seals correctly to your face, instruct you how to do a seal check for yourself. So the half mask, the N95, and then the next one is the half mask elastomeric. So the elastomeric is also a tight-fitting respirator that needs to be fit tested. It's made of natural or synthetic elastic material like a rubber or a silicone. It can be repeatedly disinfected and cleaned and reused depending on the manufacturer's guidance. It's equipped with exchangeable filter cartridges that the filter cartridges can filter that air and provide the same protection as an N95. And then the last one on the top row is a full face piece elastomeric. So it's pretty much the same as a half mask, but it does have a clear lens that covers your full face and your eyes as well. And it forms a tight seal around your entire face. and it usually provides a slightly higher protection factor. The last two respirators I just wanted to mention are powered air purifying respirators, or PAPRs. They're reusable respirators. They're typically loose-fitting, hooded, or helmeted. They come equipped with a battery-powered blower. So that's what that little, it looks like a fanny pack in the back in the picture, but it's a battery-powered blower, and then it forces air through the tube, up through the hood, and then down on the individual. The air is filtered through a HEPA filter, so it provides, usually the assigned protection factor is usually much higher for the PAPRs compared to like the N95s. And the benefit, another benefit of the PAPRs is they as well can be disinfected, cleaned, and reused, and there's no fit testing required for those. And I just wanted to cover quickly the difference between a respirator, which is all of those things I just covered were all respirators, and then just a general mask. So the respirator is designed to protect the user, protect you. It seals tightly to your face typically, and typically it needs fit testing. Whereas just a general mask, what we're required to wear now if we go out in Ohio, or not required, but recommended, is to protect others from us. So it collects the droplets that are expelled from us as we talk or sneeze. It does protect the wearer against splashes, but it fits loosely to your face, so it's not really good protection for inhalation exposures. Ideal. How about ideal protection? So if you're a healthcare worker that is dealing with individuals that have COVID-19, there's 4 pieces of PPE that are really strongly recommended. Number 1, of course, is the respirator or face mask that you should put on before entry into the patient's care area. It's preferred that at least an N95 is worn when you're performing an aerosol-generating procedure. So aerosol-generating procedures could be continuous positive airway pressure, like CPAPs, airway suction, nebulizer treatments. So those are recommended to have an N95 for those if it's possible. And again, these are ideal recommendations if the supplies are available to you. The face masks or respirators should be removed and discarded after exiting the patient area, and you should perform hand hygiene at that time as well. If your agency doesn't have a respiratory protection program present, it would be beneficial to implement one. The second piece of PPE is eye protection. So eye protection could be goggles or a disposable face shield. The face shield is actually ideal as it would protect, again, it would help shield and protect your respirator from splashes. Eyeglasses and contact lenses are not considered adequate protection. The eyeglass or the eye protection should be removed before leaving the patient's care area. And the reusable protection should be cleaned and disinfected. Disposable should be discarded after each use. The third item is gloves. You should put sterile or non-sterile clean gloves on entering the patient's care area. If they become torn or heavily contaminated, to be removed and replaced. You should remove and discard gloves when you leave and immediately perform hand hygiene at that time as well. And lastly, isolation gowns are preferred when you enter into a patient's care area. The gown should be changed if it becomes soiled. Remove the gown remove and discard the gown in a dedicated container. So if it's disposable, it should go into a dedicated waste for disposable gowns, or if it's cloth, it could be laundered after each use. So I know initial gown supplies may be limited right now. There may be a shortage, so prioritizing the gown supplies may be necessary. Again, we would want to prioritize aerosol generating procedures, care activities where splashes and sprays are anticipated, or high contact patient activities that provide opportunity for the transfer of the pathogens to hands and clothing of the healthcare personnel. So that could include dressing, bathing, showering, transferring the individual, providing hygiene, changing the linens, changing briefs or assisting with toileting, or even wound care. So we do know that the major distributors in the United States have had PPE shortages, and it's becoming a tricky balance between keeping the workers safe and delivering the appropriate medical care that's needed. So we've been prioritizing respirators for the conditions. Again, so performance of the aerosol generating procedures on COVID-19 patients is considered more of the risky condition. Also, if you are caring for patients with other infectious diseases like tuberculosis or measles or varicella, respiratory protection is strongly needed as well. And in order to prioritize supplies, there's three kind of general categories. The conventional capacity, which means that this is a set of measures consisting of engineering, administrative, PPE controls that's typically in place and everything is normal in your home healthcare settings. Contingency, though, is when these practices may be temporarily changed depending on the demands of the resources. And lastly, the crisis capacity is when these measures or a combination of these measures may need to be changed during periods of expected or known PPE shortages. So again, the conventional capacity would be wearing your surgical N95 respirators, using a face shield to protect it to maintain it being clean from airborne and fluid hazards. And if you needed alternatives to N95, you could rely on N99s or N900s or N100s, elastomeric respirators like I discussed earlier, or even powered air purifying respirators like I discussed. However, if those are not available, if there's no respiratory protection available, then we go into the crisis capacity and look for alternative strategies. So some of these alternative strategies are using the recommended respirators beyond the manufacturer's design shelf life, using the respirators under standards that have been developed in other countries. Instead of NIOSH certified, it could be certified from another agency in another country. Implementing reuse of the N95 respirators, which I'll discuss next. Using additional respirators not for health, identified as not for healthcare delivery beyond the manufactured warranty date, prioritizing the use of these N95s and the face masks, and as an absolute last resort, if there's no N95 or respirators available, using homemade face masks as a last resort. And it also is ideal if in this crisis capacity, looking at alternative strategies for administrative controls, like excluding healthcare personnel who might be at a higher risk for severe illness from COVID-19. Those would be those of older age with chronic medical conditions, maybe pregnant. That way they're reduced contact from known or suspected COVID-19 patients. Also to designate convalescent healthcare personnel from provisional care. So those would be those who have clinically recovered from COVID-19 and have some kind of protective immunity. Individuals could care for known or suspected COVID patients. So I just wanted to touch on respirator reuse recommendations. So they do recommend that if N95s be discarded if they've been used in aerosol generating procedures, contaminated with bodily fluids from patients, or in close contact with infected patients. They do recommend wearing a face shield over your N95 to keep it clean, and to hang the respirator, put the respirator in a designated area like a paper bag to keep it clean and safe. They recommend cleaning your hands with soap and water or an alcohol-based sanitizer before and after touching your respirator, or even if you adjust it to check for comfort or anything time you touch your respirator, they would recommend hand hygiene at that point. Avoid touching the inside of the respirator, and if possible, use clean gloves when donning the respirator, and performing your seal check, and then discarding those gloves after you've accomplished the task. So a lot of this information that I've just gone over was from the NIOSH hazard review, occupational hazards and home health care, and from the CDC, so interim infection prevention and control recommendations from the CDC in preventing the spread of coronavirus in 2019 in homes and residential communities. So now I'm going to turn it over to Gordon Gillespie. He's the Deputy Director of Occupational Health Nursing and is going to discuss probably more practical strategies for home healthcare workers.
Jenny. So not sure how long some of you have been in healthcare, but I remember working in emergency care when H1N1 came. And we actually went through a period where we had to reuse our N95 mask. We were issued one a week and we had to keep it in our lockers and just keep reusing them. Unfortunately, we never got any of the training that Jenny gave about how to wear a mask over it, how to store it. And like most of us stored them in plastic bags versus paper bags. So I'm really glad to hear this. It would have been great to have heard this a good 9-10 years ago though.
Hey, Gordon, can you share your screen?
Carmen, are you able to advance the slide?
Are you going to want me to? I had a shirt then, or do you want to just share it?
Oh, I can share. Let me see if I can pull it up.
It's easier that way.
Right. So kind of the focus of my part is if we accept that we're somewhere between contingency and crisis for capacity, then these recommendations are going to be things that we would never ever consider in a normal workday. Unfortunately, I'm on national web calls each week right now with the Emergency Nurses Association on their national directors, and we're talking with our membership from across the country on their mass shortages and the things they're being asked to do in the light of absence of any PPE, or that most of them have a limited capacity. And so I'm going to try to give you some, like here's a summary of the recommendations we're going to go through about how to do cloth face coverings, which again are not optimal, but it's in the absence of nothing, what do you do? Asking patients to check temperatures before arrival, looking when you're doing home care about limiting that guest access. So it's really just the patient and their significant other. Hand washing, how to create a safe zone, and this is my version of a safe zone, not like a normal safe zone you would think in terms of helicopter transport or other things like that. Maintaining physical distancing and then personal decontamination when you're in the home care environment. So the first thing is CDC does have recommendations posted on their website at cdc.gov where they talk about how to actually make your own cloth face coverings. And my wife and I did some experimentation trying to create our own. And some of the slides are just going to kind of show you how we went through it. If you have ample supply, wonderful.
Can I interrupt you? Can you switch your screen, go up to display settings and switch the screen right now? You got it into, right now it's displaying the speaker mode, not the actual display.
Will do.
Sorry to interrupt.
Is that better?
Looks good.
All right, thank you. And so one of the ways that if you have a very crafty person in your family, you can actually sew your own cloth face covering. And there are instructions on the CDC webpage on how to do this. My wife's coworker who is working from home, she's a staff member at my university and her name is Dawn. And what they've done is they've started just making these for friends and they sent us some in the mail so that we would have them when we go grocery shopping. They're not optimal for when you're being exposed to COVID, but at least it can help with some of that spray, or if you have a bit of a cough, it can at least help maintain some of your own expectorants during that time period. They also have a strategy on how to take an old t-shirt and how to take that and create your own face mask. And the next few slides will show that. Just be mindful that I am not a genius, but at least I can show you how you can go through this process. And so here you'll see that we just took a regular old white under t-shirt that we had, and we cut it about 7 to 8 inches across the bottom. And And then once you have that, then you're basically going to cut out a U shape that gets thrown away. The instructions don't really show you how far down to go, but for me, I think we did it down about 4 to 5 inches from the end. So that would be about the size of the mask. If you have a smaller size head, you might need less. And when I did this 5 inches, it was actually went all the way down under my chin. So you probably need maybe 3 to 4 inches for the part that you actually cut out. And what gets left is on the picture on the left is kind of basically that becomes your mask part, and it can tie up above your head or behind your ears, and then also tie in the back of your neck. And this is just a picture of how I did it. It does not provide much protection because the material that I used was just regular cotton. You want to use a thicker material, or at a minimum put a coffee filter or something else as a barrier that you would then use as disposable to add some added protection. And again, this is not optimal. This is really one of those where you're at that crisis stage. You have no PPE and you have a need to go into the home, and what are you going to do for some type of protection? And so this is truly, truly a contingency plan. Another strategy, if you don't have craft skills or a sewing machine or needle and thread, you can take a bandana. It's about like a 20 by 20 inch bandana, and you can use this folding process in order to get it. My wife and I practiced using one of her sweatshirts, and we just cut it up into this was a little bit less than 20 by 20. And for normally you would fold the whole thing in half, but because it was smaller than normal, we skipped step 1. And here you'll see on the right picture where we've folded it down about 1/3, and then you fold it back up. And these are the, I forgot what they're called, like little hair scrunchies, I think she said they were. And what those will then end up doing is you put those, once you folded it down, you put the hair scrunchie piece to where they're side by side and they're about 6 inches apart. And then you fold them over into each other so that flaps get folded into the top middle on the left and then the top middle on the right. So it'll look a little bit bulky, but if you have thinner material like a bandana, it won't look so, it won't balloon out so much. And then what you have is the little hair pieces are what will then go behind your ear. And so you see that this actually provides really good protection, or at least coverage, and then it also folds back behind the ear really well. It maintains its shape very nicely and it holds up. Be mindful of the material. This material, because it was a sweatshirt material, there's no way I'd be able to breathe and actually provide care for anyone. So it really have to be looking at the thickness of the material and how practical it is. And then some other things to do is really looking at ways to strategize and reduce potential exposure. So when you know that you're going to the home care, my recommendation for you is the day before, call those clients, let them know that you're coming again tomorrow, and just verifying with them, does anyone in the home that will be there have a fever? And then asking if they're planning on having a cocktail party or birthday party, because some people still are having large social events. They either don't understand the need for restrictions and quarantine, or they're not mindful of it, or they don't perceive they have a risk. And it could be cultural. So regardless of those, letting them know that if you come, and this is something to check with your employer, is can you say, well, if you're going to be having a lot of people there, that I'm going to reschedule, that I really need to come, and it's only going to be you and either your significant other, who may need to be there to help listen to the plan of care guidelines or provide information to the healthcare worker, that it really is only essential visitors, or if someone lives in the household. But asking them that when you come, if they could try to say, if there's other children or an adult children that don't need to be there at the site of the visit, like in the living room, ask if they can stay in their rooms or stay on another level of the house or something until your visit's over, to at least minimize your exposure. And then again, once you get there, have part early in the care is to do a temperature check, because if they are febrile, it may need to be that you need to defer that visit till later and have them follow up with their healthcare provider, either the nurse practitioner or physician, to get further testing or treatment so that you can then reduce your exposure to yourself. Something else to remember is hand washing, and I don't know how to emphasize that enough, and it seems like a no-brainer. And anyone you ever ask, every nursing student, physician, they'll always tell you the importance of hand washing. However, we have, Dr. Davis and I have a student now getting her dissertation work. She was following home care workers to 9 different homes the week before coronavirus, the Governor DeWine shut everything down. So this result isn't from last year or months and months ago. It was literally last month that she's following home care workers around. It's already made national news. We're already talking about it at a state. We're already making contingency plans, and then they shut the state down. That week before that, in her study, she followed into 9 homes. Upon entry, only 2 of the homes did the healthcare worker wash their hands. The other 7, they came into the home without practicing good hygiene. Upon leaving the home, no one washed their hands, which is really incredible given that coronavirus had already made national headline. We're already looking at what do we do, and we find that at this time, just less than a month ago, the workers are not washing their hands. And that's one of the greatest strategies for prevention. And so it's really just emphasizing persistent hand washing so that you're not tracking it back to your vehicle and back to your other family members. Something else you can try to do is the best you can is just pile up, like for here, it's a makeshift, like a safe zone, so to speak, so that if there is someone there walking through the home and you don't have as many droplets or other particulates kind of getting onto your equipment, is my example here on the countertop is just a placemat, and then just some kind of a little towel or something to cover up your equipment. So your stethoscope, the part where you're not going to put into your ears, try to at least minimize some of that. It's definitely going to become contaminated potentially. And nowadays it's one of those, we assume that everyone has hepatitis. We assume everyone has HIV or some bloodborne pathogen. We need to now start assuming that someone probably has coronavirus disease. And what do we do to help prevent that? Whether it's the client or someone else in the home or someone that left the home just 10 minutes ago, that we're going to be exposed, and how do we try to at least minimize our further exposure and spread? And again, it's not about prevention right now, it's more about mitigation and how to recover. And so this is just one strategy to try to keep some of the supplies and equipment covered. Of course, as you're touching the client and going back, you're going to start to spread, but at least you can minimize that in some way. And then maintaining physical distancing. I am a registered nurse, and so one thing they really focus on is therapeutic touch, giving close contact. And as you see in the picture on the left, that is optimal to have doing a client interview. But right now, that's not reasonable. Like, unfortunately, we need to maintain that distance and explain to the individuals, because especially some older adults, they don't really understand the need for this distancing. Even if they've lived through past epidemics of lower level, and they understand that they're at risk, they may not totally perceive it. And as an example, I was out walking yesterday and an older gentleman pulled up in his car, came right up against us and wanted to have a conversation about the weather, which seemed really odd, but I think he was lonely and he probably lives alone and just wants some human contact. Unfortunately, that doesn't maintain a distance. So going in the home, saying, you know, I'd really like to speak with you, I'm going to sit over here just to protect you. And quite often, if the client perceives that you're avoiding them, then that impacts satisfaction scores, and that tends to be a key driver for healthcare over the recent years. But if saying that I'm going to sit over here to protect you, because again, we don't know if I would be infected, I don't show symptoms for a while. So to protect you, I'm going to maintain a distance. And that makes it in a way that sounds very compassionate. And on the right-hand side, one of the biggest threats now also is providing handheld nebulizer treatments or breathing treatments. So look at those things, and as you see the mist coming out of the end, you don't want to be standing there. It'd be better for you to be sitting to the side of the individual, so at least some of that plume that's kind of coming out, it's still an exposure, but maybe you can minimize that because of the direction. So really, you don't want to be downwind of a person getting a breathing treatment. And as you're talking with people, remembering that historically, to protect yourself against violence, contaminants, and those things, you always want to be more therapeutic. You never sit face to face. You always kind of sit to the side a little bit. So that's an opportunity to remember those essential skills and practice that to help add some physical distancing as well. And then you also want to think about decontamination, which is something that in my past world, I would have never thought of outside of a big hazmat disaster. But here, what I have in the trunk of the car is just a bag. So all of those supplies that you are using that are single use, such as, or they're reusable, but it's like the placemats, bring one for each home. And as you get done in the day, drop them in this bag. So you can help reduce the chance that's going to be transferred over to other areas of your car. And then when you get home, then you can worry about getting all of those cleaned in nice hot water. One thing you can also do is bring some water with you. My wife and I have gotten routines now when we get back from the stores and places, and if we're worried about exposure, about how to kind of wipe down surfaces. My wife originally was using enough bleach that you could put you into an early coma, but part of it was not knowing how much bleach to use. So here, just for reference, it's a gallon of water to a third a cup of bleach, or it's a quart of water to about 4 teaspoons of bleach. Of course, if you're driving around all day, you don't want a bucket in your car because you'll have a completely soaked vehicle. But what you can do is get a larger tub with the lid and put the liquid in that and keep that in the trunk. So you could pop the lid off, clean off your stethoscope, ink pen, anything that you'd be more concerned about having come in contact that needs to have a quick decon, and doing that before you would put it into a cleaner area of your car to at least minimize it. As you may know, going to the grocery store trying to find bleach is kind of like trying to find a gold at the end of a rainbow. It just kind of doesn't exist. So using alcohol-based products that are at least 70% alcohol can help. I don't really drink alcohol, but I heard that I forget it was like vodka or something like that. So one of those drinks is 70%. So that could become an alternative cleaning agent. Of course, if you're going to use true alcohol, either mix it before you start driving, but I wouldn't recommend pulling out a bottle of alcohol as you're at the back of the car and cleaning your product. Because if you're seen by a police officer or other people in the community, they might perceive that you're drinking the product instead of cleaning with the product. So just being mindful about that. And again, so anything that's kind of soiled, put into a larger bag that you can then carry out later. And then if it's something you've just cleaned, be sure to, if you do take cleaning fluid with you, make sure it's either in a spray bottle or in like a bucket bottle that has a nice secured lid, just to reduce transference and then spills. And then once you get home, you really need to have an area that, if you have a garage, that's wonderful. You can shut the garage, get undressed in the garage, leave your shoes in the garage. But if you don't, if you live in an apartment or another type of setting where you don't have a lot of privacy, then it's having a basket or something by the door that can become your dirty zone where you can drop your soiled clothing there. Just important that as you take off your outer clothes, don't shake them. You want to just drop them until you can get them down into a washing machine, whenever that would be. And if you have your shoes, it's better if you can put them in a larger paper bag you get from like the grocery store. But if you don't, try to leave them at least outside, or put them in an area that you really won't be walking around. But it's just really important to have your, if you wear tennis shoes in the home because you have plantar fasciitis or something of that nature, just be sure you have different shoes for going out compared to different shoes going in, so that at least you can minimize the spread. And just being aware that depending on what source you use, cardboard can maintain the virus on its surface an active state for up to 24 hours, and plastic and steel can be 2 to 3 days, and some people cite longer. And the importance of that is that as you would drop, like here, I've got clothes dropped in a basket. Once I wash those clothes, that basket can still be contaminated for 2 to 3 days. So if you had cardboard box to drop in, that probably would be better, because at least this way you minimize, again, that spread as the virus, the half-life dies out. But these hours and days are based on half-life, not the total life. So just be aware of those. And if you have any questions for me, feel free to just either text those to Kermit or the strategy that he's recommending. Thank you. I guess now I'll turn off my share and then let Dr. Rootman take over.
Thank you. Hello. I'd like to make sure everyone can see my slides. So I will pull those up on my screen. And then go back in and share here. Well, let's see here. Content.
Want me to share it?
Yeah, if you could, thank you. I'm having a technical difficulty here.
Just get it up here.
Thank you. Well, while he's doing that, I would just like to
See it now?
yeah. Thank you.
Okay.
Yeah.
I'll turn mine off.
I'd just like to say that please save the date, the time to be announced next Friday, the 4th, I believe. I'm going to do an expanded presentation webinar on donations of personal protective equipment. There's just more to say than I could include today about that. And so some of you who are somewhere between crisis and contingency, some may have enough right now, but be looking to the future, trying to plan, make sure you have enough going forward. Donations may be of interest to you. Some of you may have received donations. Some have maybe not received them, not solicited them. So what I would love to hear your stories. I'm going to go through the slides in a minute, but if you could let me know the kinds of information you're interested in around donations and kind of the experience you've had, if you've had success or not had success. My email is Susan, SUSAN .Rootman, REUTMAN @uc.edu. So I'd like to hear those if you have them to help me prepare it to be a little more meaningful and relevant to you next week. Okay, next slide. Yeah. So just really an overview of the potential types of donors. Of course, business, and that's been in the news a lot. There have been stories about large businesses that made huge donations of masks, mainly to healthcare systems, hospital health systems, and also stories of small businesses like nail salons that have donated their equipment. So there are, depending on the types of exposures and the types of processes, there are going to be possibly different stockpiles of, depending on the types of PPE needs they have, whether it's respirators or gloves or whatever, different types of stockpiles for different types of businesses. And we'll talk a little bit more about that next week. But just something to think about is a large business probably has a pretty big command chain to get approval to do something like make a donation. And a smaller business may have a flatter command chain. So there might be differences in turnaround possibly, but all are worth pursuing. I mean, every N95 counts, right? And all those gloves count. So just think about, if you haven't thought about soliciting donations, that's something to maybe consider if you're in a shortage type of situation, or might be. And also independent contractors. There have been stories of construction companies, for example, donating their PPE, and also individual hobbyists. If you talk to the group leaders of where their membership, or hobbyists of a certain sort, they may have some, even some like half face masks. You'd be surprised what types of different PPE hobbyists might be harboring, woodworkers. So keep an open mind as to who might be a source, especially if you're into crisis alternative PPE. Okay, next slide then. So I want to talk about potential donation barriers, just to get you, if you haven't thought about this, to start thinking about why, what would stop donations from flowing. And I think overarchingly, it's a lack of clarity about what the donations are, what the process is, and what the benefits to the donor might be. So I think it's important to find out who needs a PPE donation the most for an employer. That's probably not a really simple task to figure out who's in shortage. It's not something that's advertised, who's going into, crisis capacity type mode. So I think there's a great benefit to writing a formal PPE ask letter and emailing it. So I think that letter needs to contain certain elements, like what PPE do you need? So they specifically, and so having seen the earlier presentations and starting to think about outside maybe just the 5-box types of PPE you might need too, like industries may have reusable elastomerics clinics more often than a hospital. So I'll go back just a little, and then so this request, when is the PPE needed? They may think it's too late. Where to start? Who's the recipient contact? Touch with? That should all be contained in the letter. Why to donate? They may be thinking, you know, we're going to need these materials when we reopen to protect our employees from other exposures they have on the job site. And so making, especially the business case, what can you do to let people know what they've done for you, that have advertising value to them, that they showed good, you know, corporate social responsibility by donating. It may benefit them in ways that are intangible among their, you know, their workforce, the positive feelings. So articulate those in this letter. And then how to donate. Make sure that they are aware, you know, of the contact person, the shipping process, the receiving process. Allude to those in the letters and be prepared to provide more detail. Okay, next slide. So just a few thoughts. Donor and recipient advance PPE donation planning. Some things you can be doing as you're readying when you have a live one, so to speak, somebody who's interested in donating it. Develop clear donation plans, procedures, just like anything, and quality standards for the type of PPE that you need, and communicate those both to the donors and to your own team, whomever that's going to be, that's going to be receiving the materials. For all donation steps and processes, there's going to be training of the employees who go, and the donor who go and gather materials, and prepare them for shipping, who transport them. You know, you'll need to decide if you're going to go get them or they're going to bring them to you. So following all those steps upon receipt of the materials, you get to train employees about maintaining the social or physical distance, and make sure they have appropriate PPE for this sort of transaction. And then next slide, and I'll talk just a little more about this information. It's good to identify on your end who, when, where, and how PPE will be received and sanitized, and also who will be checking it to make sure it meets your standards. So that also is on the distribution end. You know, you might need to do some storing of the PPE, bearing in mind the things that that have been mentioned about the life of the virus on different types of surfaces. Bearing in mind, you know, that once you receive it, you know, just being very up to date on what the latest CDC recommendations are on how to sanitize it, and anticipating those things. That you can take care of in advance before the supplies actually come, that'll speed their distribution to your workforce. Also, new equipment that people have not used before is going to require new training of the healthcare workers in how to safely don and doff it without contaminating them. So that's something also that could be initiated in advance. Okay, next slide. So just some concluding remarks. The decision to actively solicit PPE donations, there's a lot to think about. It is not a small undertaking. It would be good to assign a coordinator, have a coordinator-led donation team to manage it. And, you know, think of who your supporters are. Are there people who could help you with this in the community? You know, doing these things may, you know, substantially increase the odds that you'll acquire the PPE that you need. So I guess what I would like to say is that in closing my presentation is that so many of the people that serve, they're sandwich generation people. They're multi-generational households. They're home caregivers coming to care for a parent. There is a lot of potential for transmission when students start going back to school, bringing it home to parents or caregivers, and bringing it to the very most vulnerable people in our communities who are at home, who you serve. And so there is a strong argument for you, and framing it in your donation request would be good to protect yourselves from becoming infected or becoming transmitters. And indirectly, you'll be helping large healthcare systems as well by doing that, because you'll be preventing the most severely ill. And so I would just love to hear from you, and thank you for listening. And I perhaps will talk to some of you if you tune in next week. Thank you.
Okay, at this point, if there's any questions, you can send it to me via chat. The only one I have right now is, I think it was really answered by Gordon, was one that says, after are providing nebulized medications in home an example of aerosol generating procedures? I believe NIOSH literature says it is, and home care providers need to understand this. Gordon, would you like to talk about that?
So if I understand the question correctly, it's what do we do when we're exposed? So being exposed to the nebulizer, I would say it's definitely puts you at risk. So one thing you can do is, instead of standing face to face, even if you're increasing your distance that way, increase your distance, but also stand to the side. If it's a person that has trouble holding the nebulizer, you can ask a family member who's there to assist, because most likely when you're not there, they would be providing the nebulizer. If it's a nebulizer that's routinely scheduled, like it's twice a day, then you could always ask them to wait to do the treatment until after you've left, and that home care or the family member can help. If it's something that's for exacerbation of symptoms and they need to have it, then that's different. But it's being sure that you have your mask on at that point. If you can double the mask or something to kind of reduce your concentration exposure, but definitely standing more to their side, and having someone else other than you perform that treatment would help reduce your exposure. It's not necessarily going to prevent it. And then wherever you leave your equipment, and you're going to leave it kind of like in creating your little pseudo safe zone, don't do that downwind, so to speak, of where the person, because quite often the home care client may be in their chair in the living room. And if they are, be sure to put it like in the table in the kitchen or somewhere where you can still see what your equipment is without it being where if they are going to start coughing and such, it's not going to be, that air dispersal isn't basically aimed at your equipment, as another strategy to reduce the exposure.
Are there any other questions? I haven't had anybody else pop any up. Otherwise, I'm going to show one last view of sharing, which is just the announcement that, continuing that this is a continuing education credit course. If you click on that website, you can complete the survey and give us until I think there's got to be an update put into it for a little while. I don't think it should take that long. But and then you can also contact us at the email address that's listed here, erccoor@ucmail.uc.edu. At this point in time, this concludes our. I might have.
There's a question about if the slides will be shared.
The slides will not be shared. It'll be the at least we're going to put the link together for the whole thing was recorded, so we'll be able to provide the whole video recording, and that you'll get a link on that. Anybody that's providing us our email address, you can also contact the ERC coordinator address to request one. But at this point forward, I don't think the slides will be shared. It'll be more just the video of the session, of the webinar. So, well, thank you very much for attending. Unless there's any other questions, I haven't seen anybody pop up. But thank you for attending. Look for other additional home health care webinars coming up, as Dr. Rootman said on hers. We're also going to be doing some others on like behavioral stressors and stuff like that. That'll be coming up in about a month or so. Please stay in touch and please stay safe. Have a good weekend.